About abdominal aortic aneurysm. Well, an abdominal aortic aneurysm is an enlarged area in the lower part of the major vessel that supplies blood to the body, and that is known as aorta. The aorta runs from the heart through the center of the chest and abdomen. The aorta is the largest blood vessel in the body, so a ruptured abdominal aortic aneurysm can cause life-threatening bleeding. Depending on the size of the aneurysm and how fast it is growing, treatment varies from watchful waiting to emergency surgery. Earlier on this channel, I have already uploaded a short video about abdominal aortic aneurysm, and that is AAA. I hope you have already seen that video, and today I am going to present this illness in detail. Well, first of all, let me tell you the symptoms. Abdominal aortic aneurysms often grow slowly without noticeable symptoms, making them difficult to detect. Some aneurysms never rupture, many start small and stay small. Others grow large over time, sometimes quickly. If you have an enlarging abdominal aortic aneurysm, you might notice deep, constant pain in the belly area or side of the belly, that is abdomen, back pain, a pulse near the belly button. If you have pain, especially if the pain is sudden and severe, you should seek immediate medical help. Now let me tell you the causes. Aneurysms can develop anywhere along the aorta, but most aortic aneurysms occur in the part of aorta that is in the belly area. Several things can play a role in the development of an abdominal aortic aneurysm that include hardening of the arteries, and that is known as atherosclerosis in our medical terminology. Well, atherosclerosis occurs when fat and other substances build up in the lining of a blood vessel. High blood pressure. High blood pressure can damage and weaken the aorta's wall. And there are some other blood vessel diseases. These are diseases that cause blood vessels to become inflamed. Infection in the aorta. Rarely a bacterial or fungal infection might cause an abdominal aortic aneurysm. Trauma. For example, being injured in a car accident can cause an abdominal aortic aneurysm. Now I'll tell you the risk factors. The risk factors for abdominal aortic aneurysm include tobacco use. Smoking is the strongest risk factor for aortic aneurysm. Smoking can weaken the walls of the aorta, increasing the risk of aortic aneurysm and aneurysm rupture. The longer and more you smoke or chew tobacco, the greater the chances of developing an aortic aneurysm. Doctors recommend a one-time abdominal ultrasound to screen for an abdominal aortic aneurysm in men ages 65 to 75 who are current or former cigarette smokers. The second risk factor is age. Abdominal aortic aneurysm occur most often in people aged 65 and older. Being male, men develop abdominal aortic aneurysm much more often than women do. Being white, people who are white are at higher risk of abdominal aortic aneurysm. Family history. Having a family history of abdominal aortic aneurysm increases the risk of having the condition. Other aneurysm. Having an aneurysm in another large blood vessel, such as the artery behind the knee or the aorta in the chest, that is thoracic aortic aneurysm, might increase the risk of an abdominal aortic aneurysm. If you are at risk of an aortic aneurysm, your doctor might recommend other measures such as medications to lower your blood pressure and relieve stress on weakened arteries. Now I'll tell you the complications. Tears in one or more of the layers of the wall of the aorta, that is known as aortic dissection, or a ruptured aneurysm are the main complications. A rupture can cause life-threatening internal bleeding. In general, the larger the aneurysm and the faster it grows, the greater the risk of rupture. Signs and symptoms that an aortic aneurysm has ruptured can include sudden, intense and persistent abdominal or back pain, which can be described as a tearing sensation. Low blood pressure, fast pulse. Aortic aneurysm also increases the risk of developing blood clots in the area. If a blood clot breaks loose from the inside wall of an aneurysm and blocks a blood vessel elsewhere in your body, it can cause pain or block blood flow to the legs, toes, kidneys, or abdominal organs. Now I will tell you some preventive measures. To prevent an aortic aneurysm or keep an aortic aneurysm from worsening, you should adopt the preventive measures which I am going to tell you now. First of all, do not smoke or use tobacco products. You should quit smoking or chewing tobacco and avoid second-hand smoke. That is passive smoking. If you need help quitting, talk to your doctor about medications and therapies that may help. You should eat a healthy diet. Focus on eating a variety of fruits and vegetables, whole grains, poultry, fish, and low-fat dairy products. You should avoid saturated and trans fats and limit salt. Keep your blood pressure and cholesterol under control. If your doctor has prescribed medications for these conditions, then you should take them as instructed. Get regular exercise. Try to get at least 150 minutes a week of moderate aerobic activity. If you haven't been active, start slowly and build up. You should talk to your doctor about what kinds of activities are right for you. Now I will tell you about the diagnosis of abdominal aortic aneurysm. Well, abdominal aortic aneurysms are often found when a physical exam is done for another reason or during routine medical tests such as an ultrasound of the heart or abdomen. To diagnose an abdominal aortic aneurysm, a doctor will examine you and review your medical and family history. If your doctor thinks that you may have an aortic aneurysm, imaging tests are done to confirm the diagnosis. Now I will tell you about some tests to diagnose an abdominal aortic aneurysm. These tests include abdominal ultrasound. This is the most common test to diagnose abdominal aortic aneurysm. An abdominal ultrasound is a painless test that causes sound the ultrasound uses sound waves to show how blood flows through the structures in the belly area, including the aorta. During an abdominal ultrasound, a technician gently presses an ultrasound band, that is transducer, against the belly area, moving it back and forth. The device sends signals to a computer which creates images. The next investigation we might order is abdominal CT scan. This painless test uses X-rays to create cross-sectional images of the structures inside the belly area. It is used to create clear images of the aorta, and abdominal CT scan can also detect the size and shape of an aneurysm. During a CT scan, you lie on a table that slides into a donut-shaped machine. Sometimes contrast material is given through a vein to make your blood vessels show up more clearly on the images. Also, we may order an abdominal MRI. This imaging test uses a magnetic field and computer-generated radio waves to create detailed images of the structures inside your belly area. Sometimes that is contrast material, is given through a vein to make your blood vessels more visible. Now I'll tell you a little bit about screening schedule for abdominal aortic aneurysm. Well, being male and smoking significantly increases the risk of abdominal aortic aneurysm, as I just told you. The screening recommendations vary, but in general, men ages 65 to 75 who have ever smoked cigarettes should have a one-time screening using abdominal ultrasound. For men ages 65 to 75 who have never smoked, a doctor will decide on the need for an abdominal ultrasound based on other risk factors such as family history of aneurysm. There is not enough evidence to determine whether women ages 65 to 75 who ever smoke cigarettes or having a family history of abdominal aortic aneurysm would benefit from abdominal aortic aneurysm screening. You should ask your doctor if you need to have an ultrasound screening based on your risk factors. Women who have never smoked generally do not need to be screened for the condition. Now I will tell you about the treatment of AAA, abdominal aortic aneurysm. The goal of abdominal aortic aneurysm treatment is to prevent an aneurysm from rupturing. Treatment may involve careful monitoring or surgery. Which treatment you have depends on the size of the aortic aneurysm and how fast it is growing. And the first option is medical monitoring. Well, when patients come to us, we might recommend this option, also called watchful waiting. If the abdominal aortic aneurysm is small and is not causing symptoms, monitoring, in case it is very small and it is not causing any symptoms, then monitoring we advise, okay? And this watchful monitoring requires regular doctor's checkups and imaging tests to determine if the aneurysm is growing and to manage other conditions such as high blood pressure that could worsen the aneurysm. Typically, a person who has a small symptomless abdominal aortic aneurysm needs an abdominal ultrasound at least 6 months after diagnosis and at regular follow-up appointments. Then the next option is surgery, and there are some other procedures. Well, surgery to repair an abdominal aortic aneurysm is generally recommended if the aneurysm is 1.9 to 2.2 inches, that is 4.8 to 5.6 centimeters or larger, or if it is growing quickly. Also, a doctor might recommend abdominal aortic aneurysm repair surgery if you have symptoms such as stomach pain or you have a leaking, tender or painful aneurysm. The type of surgery performed depends on the size and location of the aneurysm, your age and your overall health. Abdominal aortic aneurysm surgery options may include the first surgical option is endovascular repair. This procedure is used most often to repair an abdominal aortic aneurysm. A surgeon inserts a thin flexible tube, that is catheter, through an artery in the leg and gently guides it to the aorta. A metal mesh tube, that is graft, on the end of the catheter is placed at the site of the aneurysm, and it is expanded and fastened in place. The graft strengthens the weakened section of the aorta to prevent rupture of the aneurysm. Endovascular surgery is not an option for everyone with an abdominal aortic aneurysm. You and your doctor will discuss the best repair option for you. After endovascular surgery, you will need regular imaging tests to ensure that the grafted area is not leaking. And there is another option, that is open abdominal surgery. This involves removing the damaged part of the aorta and replacing it with a graft which is sewn into place. Full recovery may take a month or more. Long-term survival rates are similar for both endovascular surgery and open surgery. Now I will tell you some lifestyle and home remedies. For an abdominal aortic aneurysm, a doctor will likely suggest avoiding heavy lifting and vigorous physical activity to prevent extreme increases in blood pressures, which can put more pressure on an aneurysm. Emotional stress can raise blood pressure, so try to avoid conflict and stressful situations. If you are feeling stressed or anxious, let your doctor know so that together you can come up with the best treatment plan. Well, this was my video about AAA, abdominal aortic aneurysm. I hope you like this video. If you have questions about this illness, or if you want me to upload a video about another medical illness, for that video is already not there on this channel. Please let me know in the comment section, and as soon as I get a time, I'll try to post a video about that particular illness. Thanks for watching this video. See you in next video. Bye for now.